Welcome back to the final session of what's been a really packed day today. We're going to be discussing how COVID has affected for-profit healthcare.
Hello. So how has COVID hit the healthcare services sector across EMEA? To answer that question at a subsector level, I turn to our data platform, HBI Intelligence. This amazing product covers 15 subsectors across EMEA, with each report covering between 12 and 22 countries. It's linked to a database of 4,000 companies across Europe and emerging markets. So you can immediately see the market share for hospitals in Germany, or the lab sector in Poland or Ukraine. So here I wanted to look at the impact of COVID on a few subsectors, and then also give my thoughts on the future. Thank you. Can I have the first slide, please, Richard? So this shows really what a dismal year it has been for those sectors of the healthcare sector which are heavily dependent upon electives. In other words, people taking the choice, choosing to have operations or procedures at specific fixed times. The sectors which have done well are also interesting. As you can see, they're either essential, like dialysis, or near essential, a category which care homes would fall into. The second reason they've done well is because in some countries, they've either had a lot of government support or they've been given a lot of contracts. This is particularly true for France and Germany, for instance, in the hospital sector. And it's why the hospital sector looks more buoyant than, say, imaging or dentistry. The third reason is if they're in digital. So as you can see, telehealth, shown on the far right, has really soared this year. There'll be those amongst you who think that the figure we've got here is quite low. I think that's because this is a reflection of our estimate of the revenue of telehealth platforms. And in practice, a lot of the 3- or 4-fold increase in telehealth consultations is being done on the more general platforms, which we're not capturing. And it's also true to say that the big telehealth platforms in Europe often were giving away volume in the first half and giving their platform almost for free to the public sector. Looking briefly at some of the other sectors here, teleradiology is interesting. The elective part crashed in the first half. And then this enabled radiologists sitting at home to start to clear their lists, which of course is also bad for teleradiology groups. So we're not really expecting a recovery here until mid-2021 at the earliest. Imaging also hit a lot of elective work again, no major role in contracts that we know of in the COVID epidemic. And dentistry, of course, a full closure in most countries for 2 months, and then a rather slow return. So let's look at a sector in more detail. Let's look at hospitals. Richard, can we have the next slide, please? So here, as we can see, we have the winners on the right and the losers on the left. Looking at the winners, in Germany, the hospital sector was given a flat daily rate for every bed of 560 euros per day, for every empty bed, for 560 euros per day. This actually meant that sales in the first 9 months were 4 or 5% ahead. But that financial support ended on September the 30th. And as far as we know, it's not been reinstated. In France, of course, the 85% of business done by the state insurer was protected. Looking at the Middle East and Russia, markets which have done comparatively well, we first of all know that the UAE and Saudi numbers are good because there's now a lot of listed groups, particularly in Saudi Arabia, in fact. And secondly, I think we can say that in the Middle East, we've seen a return to procedures in the Middle East and a lower propensity for states to send people on abroad. And of course, medical tourism generally has dropped. So that's been a factor which has driven revenue in the Middle East. In Russia, I think it's about people not wanting to go to the public sector. Let's look at the third slide then, dentistry. As you can see, Italy has been the hardest hit. When we talk to dentistry groups in Italy, they say this reflects the fact that there was a lot of economic uncertainty before COVID hit, and just the viability of many dentistry businesses is under threat from that. They're not expecting a fast return. In general terms, the harder the lockdown, the better, according to the large dentistry groups we're talking to. They say it's best where a country cracked down and then went back to freedom afterwards, or near freedom afterwards. And that explains perhaps why the Swedish figure looks particularly bad, because of course they never actually had a lockdown. This is a worrying trait because it suggests that the next 4 or 5 months, in which, of course, Europe is going to be going through a series of mild lockdowns with a lot of ambiguity, that may well discourage many patients who would be seeking treatment from coming forwards until the vaccine arrives. The UK reflects the preponderance of NHS payments, and the NHS has supported the sector here. So that's why the UK has done so much better here. So let's look then at the fourth slide. Diagnostic laboratories. The manic depressive sector. Well, I should say perhaps depressive manic sector. We were talking to people who were saying, investors who were saying in May, April, May, that they were working out how to make most of their staff redundant, how they could exit from rental contracts and wind down a lot of the business. And yet, by July and August, they were flooded by government contracts. So it is, the big issue really here is the government contracts which have come into force. And those contracts have had a startling effect. In some countries, we're seeing third quarter results for some companies up 66% on a year ago, for example. So the big issue with labs is working out what the real level of trade would have been without COVID, or rather separating out the elective work, which has been damaged by COVID, from the contract work, which has replaced it. For example, in Belgium, we know that it's recorded that in the year to August, there's been a 5% drop in revenue from elective work. And yet the groups in Belgium are reporting a rise in sales. Synlab, for example, was recording a 3% rise in the third quarter. The other imponderable here is whether the closer relationship the lab groups have formed with the public sector will survive when COVID is over. All this is, of course, of great importance given that Synlab and Unilabs are both looking to either sell or IPO. So it's very hard to get an accurate figure. We've revised these figures during the course of the year, in some countries 2 or 3 times, and we're not at the end of that process. Let's look then at nursing homes. So here, as you can see, it's a much more stable picture overall. You can differentiate between emerging market countries like Russia, which is on the far left-hand side because it's expected to grow only 12% this year, as opposed to 25%, according to one of the major nursing home groups in Russia, because of COVID, and between Western Europe, where the figure is much more gradual. And on the far right there, we've got Scandinavia and Switzerland, where there's more stability. Okay, let's look now at the next slide. This one looks at, what we can say about profitability. It shows that Germany, Scandinavia are green markets, as is surprisingly Romania. I suspect the same is probably true for Poland. And then you've got the red markets, and perhaps there's no surprise there either with Italy, the UK, and Portugal. But I think what it does emphasize here is that countries with really stable regulations and with money which can't be grabbed by the state, such as Germany, are much safer bets than countries where that is not the case. So let's look at the future then. What is going to happen? So can you end the slides there, Rich? So what's going to happen over the next 6 months to a year? Well, as the example of the lab sector shows, in all honesty, forecasting the future at the moment is very difficult. What we can say is that the consensus forecasts from economists, according to Morgan Stanley, really show that the European Union and the UK economically will take 2 years to recover to pre-COVID levels. So that means that after the dip in 2020, it'll be 2021 and 2022 before Europe and the UK regain the GDP they lost in 2020. India, Brazil, and the USA recovery within about 1 year. So we're certainly facing a recession, and there was a recent EBRD survey of 40,000 people, and they were asked, since the end of February 2020, have you or anyone else in your household had to take any of the following measures as a result of a decline in income or other economic difficulties? So consumers in emerging markets reduced food expenditure by over 1/5 of Belarusians, 1/4 of Ukrainians, nearly 1/3 of Egyptians. For Central and Eastern Europe, the figure is 20% for Greece and 10% for Poland. And when you ask, has anyone you know in your household not visited a doctor for economic reasons? Yes, nearly 1/3 of Serbs and 1/5 of Poles, and surprisingly 24% of all Italians. The figure is even 9% for Sweden. So I think there will be an economic hit, recovery will be delayed, and I think we're going to see a particularly tough first quarter. We know that many patients will stay away, either because they're cash strapped or for fear of vaccines in the first quarter of 2021. The question is how willing governments will be to put extra money in to alleviate this. I think that it is likely that the generosity will lessen as they see light at the end of the tunnel. And I think it's also true that in general terms, the public sector is going to be a major beneficiary here. So in the UK, there's the possibility of £10 billion being spent on electives in the private sector over 4 years. But we don't really know how much will be spent. And we suspect that large block buying deals will mean that the rates on offer, the terms will be tough. There will also, I think, be pressure often for doctors who work in both the public and private sector to do their work in the public sector. So is there no light at all in the picture? Yes, there are. First of all, the beneficiaries of all this are likely to be the larger groups, and the larger groups typically are seeing revenue growth, which is often several points higher than the revenue figures we've discussed here. It's probably a good time to be owned by private equity, because we think that in all sectors, the generational move will accelerate, and there'll be plenty of people running smaller groups which have not fared so well because they haven't had access to capital, because they haven't been large enough to win government contracts, because they haven't been able to implement digital. Who will want to sell? And it is undoubtedly true that some patients faced by enormously long waiting lists will decide to go private. But overall, I think it is fair to say that the outlook is for fairly slow growth over at least the next 6 months and probably the next year. Okay, thank you very much.
Thank you so much there, Max. And delegates, please post your questions while everybody is digesting that and thinking about what they want to say and do. The overall tone there seemed fairly pessimistic, didn't it? Why do you think that is?
Well, I do feel that we are, it's clear that we are going into a recession. And it's also clear that many people over the next 6 months are going to think twice before going to the doctor. So I think it's very difficult to see how the next short while is going to be good, and that also you've also got the problem that we don't really know what deal countries are going to do with their for-profit sector as they buy and build capacity at the moment. They've been quite generous in the first 6 months, 9 months of 2020, but as they see the vaccine coming up on the horizon, it's not clear exactly what the deals are. So when you talk to chief executives, they're they've got a very unclear picture of what is going to happen over the next 6 months. They just haven't got the visibility on where to go.
Of course. Now, we've got a question posted here. Do we expect to see a lot of extra demand as waiting lists rise? Presumably, yes.
Well, yes, the answer is yes, you will see a lot of extra demand rising as patients wait longer, and we've seen these huge rises in every country, really. The question then becomes, how soon is that demand going to hit? Because, again, people are going to wait, I think, before they get treatment in many cases. And secondly, is the for-profit sector going to be allowed to deliver that treatment insofar as, a lot of the time the doctors who are giving the treatment in the private sector actually work in the public sector as well. And I think many state payers are going to say, look, we'd rather you worked in our hospital than gallivanted off and worked in the private sector. So yes, there are enormous waiting lists. Yes, over the next 3, 4, 5 years, there's going to be huge demand. But when it's going to materialise, it's hard to say.
And one further question, what does the public sector's use of private capacity for lab tests and hospitals during the pandemic say about attitudes towards outsourcing?
Well, I mean, basically, at the start of the pandemic, the state sector was very opposed to using the private sector generally. And we had instances where, for example, a private hospital or lab group would be buying PPE on the open market and have it confiscated when it got to the country's borders because the NHS, the local NHS wanted the material so much that it just took it. So that then changed, and by the summer it was morphing into using the capacity, realising they needed to work with the private sector, whether that's labs or hospitals, and they wanted to buy that space and use it. So the relationship became much closer, and so in many cases, lab groups were saying, "Oh, we're now being welcomed by the ministers of health. We're now getting access even at prime ministerial level. These people want to talk to us." So of course, and they're now saying, "Well, that's great. We've developed these strong relationships with these people." But I don't know that we necessarily know what's going to happen to those relationships in 3 months, 6 months, or a year's time. Whether it's just going to spring back, or whether those relationships, I guess those personal relationships are going to be quite sticky. And so at one level, you are going to see more cooperation than we've seen so far. But again, it's just this total lack of certainty that we see coming out of COVID, I think.
Okay, Max, thank you so much.
Thank you. Okay.
So that wraps up day one of HPI 2020. Thank you so much to everyone who has attended, spoken, asked questions and engaged with each other and done all the other things to make this a success. So see you tomorrow, 8 a.m. London time. Have a good night.
Thank you. Good night. Thank you.